Good morning, Peter Goertz. I'm a psychiatrist. Just set boundaries. Have you heard that? Easy to say. I do a good amount of psychotherapy, a lot of medication management, but also I see a lot of patients, at least in part, for psychotherapy. And a lot of the patients struggle with standing up for themselves, and sadly, especially female patients. And one could say the work that I do with the female patients is working on turning them into a tigress and making no their favorite word, for example. Now, safety is a consideration. So if you want to say no, just make sure the situation is safe. Someone's not standing in front of you with a gun, for instance. That may not be, a situation like that may not be the right time to directly stand up for yourself. So again, easy to say, stand up for yourself, say no, don't take any unfairness, don't be taken advantage of, but not necessarily easy to do because we want to look at the roots of what's going on, and those roots can be subconscious or even unconscious. So if someone's been sexually abused as a child, let's say by their father, they may develop the unconscious belief that in order to receive love, they need to accept abuse. And that might continue long term. I remember an example of a patient resident was seeing that the resident told me about. She was in her 50s, living with a man, having sex with a man, but not interested in sex with a man, and she'd been abused sexually by her father from age 3 to 6. So she was potentially continuing in the same manner, giving sex in order to survive, in order maybe to receive love or feel like she was receiving love. And one sees patients, I at least see patients very frequently who struggle with standing up for themselves and endure abuse, whether it's verbal abuse by a husband or even just language that doesn't seem comfortable. So very sexual, direct sexual language that the lady doesn't feel comfortable with hearing. And an example I'm thinking of a patient who was abused that I saw recently was a lady who'd been sexually abused in childhood and then physically severely abused by a husband to the point where she had a bleed in her brain from physical abuse by that husband. So we want to, all of us, be able to stand up for ourselves in various arenas. So work, sexually, as a caretaker, people can be caretakers and be taken advantage of, not have their own life. And being taken advantage of, for example, as a caretaker, if you're constantly taking care of your partner, for example, not having time for fun, that can have emotional and even physical repercussions. So often when I see someone who, let's say, has dementia and the caretaker's in the room, I turn to the caretaker and ask them, how are you holding up? And it certainly can be that they burst out into tears. So being a caretaker, for example, feeling taken advantage of, can really have emotional repercussions and even physical repercussions. So you don't want to burn yourself out, and that of course doesn't help the person whom you're taking care of. Regarding myself, I grew up with a mother who was quite troubled, and I might have developed at that time that the belief that I was not worthy of love by a woman who was stable, or maybe not worthy of love, period. And sure enough, then later in my life, I was involved with some women who were not very stable and maybe not able to love me. So these things really have repercussions, and if we don't get in touch with those beliefs that the difficulty standing up for ourselves is based on, then we can really continue to perpetuate a pattern of being taken advantage of, potentially being abused. And the issue is simple, of course, but not easy, because we definitely do want to stand up for ourselves. We want to avoid being abused. But in order to do that, in my opinion, we do need to get in touch with those beliefs that the difficulty standing up for ourselves is based on, those beliefs that the difficulty standing up for ourselves are based on. And that can take some time, can take a good amount of psychotherapy. Some people may be able to do it in a shorter amount of time, but the principle is we want to get in touch with what's underlying our difficulty standing up for ourselves. And then definitely things really can shift. So I have seen ladies turn into tigresses. Thank you.